Hi, I'm Ralph Weiche. I am an emergency physician here at St. Joseph Hospital, and I'm the supervising physician for our Bellingham medics here in Whatcom County. And I wanted to talk a little bit about the communication between EMS and the hospital. And there's probably three different ways that you will communicate to the hospital. One will be when you give report, when you drop your patient off. One will be when you make a phone call, you talk to the nurse team leader and give them a heads up about what you have coming in. And a third way that you might interact is you may call and want to speak to the star doctor because you have a specific medical question, or you need some help with management, or you're in a situation that's outside your protocol and you need some online answers and have some questions. So I am putting this out in response to some of the feedback that I've got from the physicians where when they get a phone call, they're not always quite clear as to what the question is and what it is that you need from them. So I would offer one recommendation for trying to format your question, particularly when you talk to the star doctor and particularly when you have a situation and a question that you want to ask the star doctor. One of the ways that we communicate within the hospital is with our nurses and other ancillary staff is they will often communicate to us in what we call an SBAR format. And so SBAR, S-B-A-R, stands for situation, background, assessment, and recommendation. So I would suggest that you use that format if you're calling the star doc and you have a specific question. So the situation might just be that you've got a 57-year-old male with chest pain who's refusing transport. So that kind of tells me right up front why you're calling me. The background is that this guy has a history of coronary disease and he's got a non-diagnostic EKG, and he's having ongoing chest pain. So that's his background, his medical information. This is your assessment as somebody who's having chest pain, ongoing chest pain, and he's got an equivocal EKG. The R and the recommendation, your recommendation, the reason for having that part in there is that really helps me and helps us have context of what it is you're seeing, what you're thinking, and what your recommendations are. You don't have to be spot on with having the right answer, but if you can give us your recommendation, again, that gives us the context and understands what you're seeing and what you're thinking and what your recommendations are. So your recommendation might be that I'm concerned that this patient has acute coronary syndrome, and I believe that he needs to be treated and transported, and I want to give him aspirin, nitroglycerin, and transport. And so we understand that you're seeing a patient and that the question is regarding refusal of transport, and you want our recommendations as whether that would be appropriate or not. Maybe it's a call about a 58-year-old female with a history of migraines. That's your situation, that's your background. Your assessment is that she's having an ongoing headache and her blood pressure is 190/110. And you're a BLS unit and you're concerned about that blood pressure. It's outside your protocol for transport, but this seems to be her index migraine and you're not finding any focal neurologic findings. And so your recommendation would be that I believe that I can transport this patient BLS and does not need an ALS transport. Is that a reasonable request? So those are kind of an examples of how to use the SBAR format, particularly when you contact the star doc. When you speak to the nurse team lead, or when you give your report, you have your protocol in your EMS protocol that talks about identifying the transporting unit, giving the patient's age, the vital signs, the pertinent history, treatment, full name, and when your estimated time of arrival is. So that's an excellent format for when you're giving your report and you're communicating to the NTL, and that's information that you should all know and be prepared to give. Some of the feedback from the NTL and the nurses that is not necessarily in that protocol, but something that they've specifically asked me to relay to you that they feel is very important, is that it's really important for them to know what facility you're bringing them from. Are you bringing them from home? Are you billing from a skilled nursing facility? Is it an assisted living facility? Where are you bringing them from? And has any family been notified? Can we expect any family to show up? And is there anybody else involved? That really helps us out a lot, because that's really going to make a difference when we're trying to decide, okay, what information do we have to work with? Is there a family member going to come in and going to be able to give me a little bit better information? Can I count on that? Or I just need to make a decision with what I have? And then we're already thinking about our disposition. We're already thinking about, does this patient need to be admitted? Do we need to get care manager involved? Is this patient going to be safe to go home? And that's going to depend on what their situation was at home. There's no way for us to know that. We really rely on you to give us that information for what the home situation was like and what the family situation was like. That really helps us out a lot with our disposition. So that's my main points that I wanted to bring up regarding communication with the doctors, with the nurses, with giving report. And I hope that's helpful. Thanks.